All right, guys, today we are working on the mind-body connections and the body-mind connections. Yes, it is two separate chapters, I promise. So objectives today is to understand relaxation response, know the physical effects of relaxation response, discuss chronic stress and the effects on the body, and examine different breathing techniques. So there is a freeze component driven by a There is a freeze component driven by a parasympathetic nervous system. And when that is under threat, when someone is triggered or feels overwhelmed, that can start to show as chronic stress. We have to think of the mind and the body as one. And the chronic pain can cause chronic stress. So they are both connected. And how you feel, again, will influence your body's process and your body's response to that, whether you're sad, happy, angry. Stress is defined as the perception of a threat and the perception that you are not well prepared to cope with it. Your body typically goes through this fight or flight response. You'll get a headache, shortness of breath. These are those immediate responses, or some longer responses are weight loss or gain, and depression. You can have increased blood pressure, increased breath rate, changes in the blood flow to the muscles. Your body can release adrenaline and go sort of into overdrive. There's lots of different ways your body can respond to that chronic stress. Relaxation response was discovered by Herbert Benson in the 70s, and this sort of plays a role in quieting the body's response to that stressor. It must be practiced. It's not something that happens right away, but it does help your body sort of recover from what your body is going. And it happens in two simple steps. Star this: focusing one's mind on a repetitive phrase, word, breath, or action, and then adopting a passive attitude towards the thoughts that go through one's head. The physical effects of relaxation response can be confused with relaxation, but really the relaxation response is a natural response to the body, and how your body will respond to that stressor again. And by practicing it, that chronic stress symptoms will reduce and never develop in time. Again, it takes time and practices. The immediate changes that you can do is, again, focusing on that repetitive word or phrase, breath or action. Doing it, by doing that, that lowers that blood pressure, the heart rate, the breath rate, and that eventually, the more that you work on that, the more your body doesn't respond to that stressor in the first place. Long-term changes occurs after repeated practice for at least a month, and soon these frustrations will become less and less, and then you don't see them set you off in these chronic stress situations as often. Breathing is one of the biggest keys to relaxation response. Your breathing and your awareness to your breath. There are two types of breathing, chest and diaphragmatic. We already know that. Chest, the stomach stays still, but the chest expands. And the other one is where the stomach moves, or abdominal breathing, I guess you could say. You can focus your breath and how it's coming in to help decrease your pain and increase your control on what's happening. And diaphragmatic breathing is the one breathing that's shown to bring on a calm, relaxing feeling. So there are basic techniques and advanced techniques. So your basic techniques are using a focused word or phrase. Again, that can be from a quote, or you can do this. Just breathe, just breathe. Using that focus on that one word or phrase. Coupling breathing with imagination. Seeing your breath come in your body, in through your lungs, working your way through the lungs, back out your mouth. Or imagining the breath kind of come in your right hand and out your left hand, and seeing it go through your body is using that breathing with imagination. Progressive muscle relaxation, I've done this in yoga a lot, where you focus your energy on your feet and you do your breathing and you allow your feet to completely relax. Then you move to your calves and your thighs and your stomach, abdominal muscles, just progressively relaxing all of your muscles in your body. using a repetitive motion that depends on making sure it's not causing increased pain, or just creating a safe space for you to go. Some more advanced techniques are self-hypnosis and pain control visualization. So let me just pause this for a second and I will bring up the next slide so we can go into it. So the next one is the body-mind connection. It's going to sound like the same thing, but we'll go into it, so just hang in there with me. You want to learn about the attitudes and behaviors associated with chronic pain. Discuss how chronic pain patients can increase activities. Talk about how your body can change your mood. That's the one bullet I really like to do. And understand how to work with chronic pain. Your body can really be a resource to you as long as you are allowing yourself to do it. So if we think about when you're in pain, you might ignore the sensation. So whatever pain you're having, you're just putting it back on the back burner, not listening to it, and just ignoring the sensation. You might stop moving your body parts, except when it's absolutely necessary. I've seen a lot of patients do this where they refuse to bend over or refuse to bend at the waist or move their arm because they know that that is going to cause pain in their body, so they don't do it. You might withdraw from social interactions and not do the things you used to, or push yourself physically by denying your condition altogether. I have seen a lot of athletes do this where I'm not in pain, I'm going to do my thing, I'm going to get over it, I'll be fine. And that is not always the best thing you can do. So those attitudes in the last slide cannot need to be challenged, and these are feeding your fear of your activity, make you do far too much. It can decrease muscle mass and endurance, possible re-injury. If you're doing things that you shouldn't be doing, that can be a problem, or you can isolate and become depressed. You have to learn to listen to your body and to start to pace yourself, and here are ways you can do that. So, 3 strategies: pacing, adaptation, and delegation. These are 3 strategies used to keep active while in pain. So think about your chronic pain patients, okay? One strategy, pacing, conserving your energy over that long haul of what you're trying to do. So instead of sprinting, you're going to walk. Instead of working harder, you're going to work smarter. Allowing yourself to understand how long you can stand and determining what activity you can do for that amount of time without overdoing it. Adaptation is finding a new way to conquer a task that's less painful. So you can sit to do your dishes or sit to fold the laundry. Adapting the activity so it's not as bad as what it was. And also delegation. So job sharing. You carry the laundry, I'll fold it. You can go get the bills, I'll write all the checks. Those kind of things. Time management is also important. Developing a routine and then scheduling the time to do things in this routine. In order to pace, adapt, and delegate effectively, you want to look at your whole day. If you are rushing to do everything in the first 4 hours, then your afternoon might be terrible because you did too much. So understanding where your timeline falls and what you can do is important. And time pies, determine what you do in a day. Make each activity a wedge in that time pie to determine what it looks like. And then listening to your body. Your body will tell you when you are doing too much. So explaining that to your patients. I can't tell you how many times I've said that to my patients. Your body will tell you when it's too much. And then you can have a little bit better control and on the whole situation yourself. We don't want them to stop moving. We don't want them to push through because it hurts so bad. That no pain, no gain method, that's not always true. But we do want them to understand how their body is responding, because if they can understand it, then we can help them through it if we understand more of what they're doing. So use your body to change your mood. I know I just talked in the last PowerPoint about talking with my counselor about this, and it's fully effective from what she has said. I was talking about you guys, and then I was just teaching this lecture. But your body posture and facial expression can make a difference in your whole mood. What is your body communicating to the outside world? What are you trying to say or present? And you have the power to change how your body is reacting. I am not having the best of days today. My stomach is sore. I think I did too much yesterday. I'm a little crabby because my son was giving me attitude this morning, and I'm crabby. But you know what? I sat myself down and I realized, okay, what's happening with my body right now? I'm hunched. My eyebrows are, I'm like scrunching my eyebrows. I'm scrunching my face. I feel tension in my shoulders. I'm not smiling. I'm frowning. But if I take a moment to close my eyes, and even you guys can do this now. If you take a moment and close your eyes and sit in a chair and then put your head up, face front, your arms down by your sides, shoulders back, eyebrows relaxed, and then smile so you show your teeth. And how does your body feel? A little bit more presentable, right? Whereas if I have you guys hunch over and curl your eyebrows and tense up your shoulders and tense up your body, you're going to feel more feelings of sadness or insecure, upset, or mad, or, your body posture and facial expressions can be an emotional response for yourself. And you have the power to change that. I had the power to change that today. So working with chronically ill patients who return to work must learn to pace themselves as they did at home. You will have people go back to work too soon because they have to financially, or they're being told to by their doctor. You can't fix that. But what you can do is give them the tools to keep moving and be productive. If it's a lower back patient, making sure that they're setting a timer on their phone so they get up and they move around, and every hour or 30 minutes or whatever you think that they need. Some people may not be able to return to their jobs. If it's too much of a physical job that's going to hurt them too much, that might be something that you'll have to advocate for them. Again, you will also know about ergonomics. So if you have a neck patient or a carpal tunnel patient, your ergonomic assessment for them is very, very important. Okay, so after this chapter, I want you guys to do a time pie chart. So I want you to draw it out or do it on Word or wherever you want to do it and map out your day. So how much of a slice are you going to dedicate to sleeping, to schoolwork, to work, to food eating, to exercising, to phone time? And I'm curious as to see how that looks for you. And then write up, is that what you expected? Are you spending too much time maybe Facebooking and TikToking? Or are you spending more time? Should you be spending more time studying? And it doesn't have to be a page. Just see if you've realized anything in that little assignment that I'm having you do. Okay, if you guys have any questions, please let me know. I am happy to help. We'll talk to you soon, guys. Bye.